In about 2001, I was 54 years old, and almost to the very day, a year later or earlier, my husband had passed away with a heart attack. And I was sitting down in the cafeteria, and for about 20 minutes I just sat there, and I couldn't move. My limbs, my upper body was really, really heavy, and my coworkers that I was sitting with got really concerned, so they whipped me up to the emergency department. And so I went through a battery of tests, and I honestly thought that I had just had a broken heart. But unfortunately, it wasn't that. It was something a lot more serious. I needed to have a new aortic valve, and I needed a triple bypass.
Well, I had been out gardening, came in the house to eat, and didn't feel very good. Made a sandwich and thought, oh, I can't eat it, I'm going to be sick. And then I felt like I had something sitting on my chest.
It was September 23rd, 2006. I just finished cutting the grass. I came in and took a shower, came back downstairs, and I had a sudden cardiac arrest.
We came in and prognosis was not good. We were told that right off the bat. We were told if he did come back, he would probably have brain damage.
Probably the worst part of the whole thing was worrying about my son. He's 23 years old, and he just lost his dad, and I thought, holy crow, hope he's not going to lose his mom.
Good evening, ladies and gentlemen. Each of you has shown your support for Ridge Meadows Hospital by attending tonight's events. We are extremely grateful. Tonight, you'll have a unique opportunity to make even a greater difference.
Heart attacks are the most common cause of death in North America. And when you or someone you know is experiencing chest pains, our staff know how vital it is to get a good ECG tracing within minutes of you walking through the doors of our hospital.
We are a small community hospital, and it's a great hospital. We've got a huge amount of knowledge and expertise here.
I wasn't breathing. They got me back to life.
I was very fortunate that I got help as quickly as I did.
I know that we have seen many of the guests tonight in our department getting tested for heart disease. The staff at Ridge Meadows Hospital who perform ECGs depend on reliable, up-to-date, and user-friendly equipment.
Last year alone, we did 5,200 cardiograms. That equates to 100 a week or 14 per day, plus all the ones that are done in the emergency department.
With constant technological changes and a growing community, there is an increasing need for better and newer ECG equipment. Heart disease is still the #1 killer of men and women in Canada. This is an ECG machine. ECGs are crucial in diagnosing and treating heart attacks and dangerous heart rhythms.
The Foundation and the lab have had a wonderful partnership over the years, and we are really thrilled that they have considered purchasing 3 cardiogram machines this year for our use.
I'm a cardiologist at Ridge Meadows Hospital. I have dedicated my life to improve and save yours. Each ECG machine costs $17,000. A lot, I know, but your good health is priceless.
I just don't take anything for granted anymore.
I've cut back work to part-time. I enjoy myself fully. We're traveling, enjoying the kids, and just having a great time now. Live one day at a time.
We're all very thankful. We realize that sometimes the most important things in life are the ones that we take for granted.
The reality is we don't know what the future holds for our health.
Maple Ridge Hospital needs help.
Tonight, you are being asked to give generously towards the purchase of new ECG equipment for Ridge Meadows Hospital.
So that the patients of Ridge Meadows have the best possible patient care.
I encourage you to dig deep into your pockets and get another one of these ECG units for Ridge Meadows Hospital.
And I'd like to just echo that encouragement. I think at Ridge Meadows Hospital we really do have the key success factors, and that's the great people that we've interacted with. We need to give them the tools and technology and the infrastructure, so dig deep into your pockets and your hearts and let's get these units.
So what can I say but open up your pocketbooks, write those checks, and let's get going.
You'll now be asked to make a personal gift towards the purchase of an ECG unit. Please give from the heart. Together we'll make this happen. Thank you.